It just kind of dawned on me. I push play. My favorite is just like the quiet, oh shit. Right
Was that what it started?
It just literally didn't start on you. It started with me pushing play. You're like, because we talked about what we're talking about today, which is going to be how to recover revenue. Because I imagine a lot of people are worried about lost revenue after seeing WellCare's numbers come out. Mm-hmm. But just the, oh shit. I'm sorry. From the sweet little you. Just the soberness behind it. Good morning, everybody. Welcome to the Medicare Cafe.
It's not pre-chat. It's 10.
It's 10 o'clock.
We're live. We're on.
Well, we were talking about hair before
hair.
This.
We were talking about hair.
Like how if you have curly hair, you want straight. If you want straight hair, you want curly.
I have curly hair that I straighten.
I have straight hair that I curl. So there you go. Welcome, everybody. If this is your first episode, oh no, they have the weed blowers and stuff going outside.
Oh, they're right there. Sorry. Hopefully this awesome room blocks all that out.
It doesn't.
It doesn't. You can hear it.
So this is the studio. No one's asking questions, but I'm going to tell you the answers. Our studio is actually an external wall that was an addition to the building once we bought it. And so we were like, oh, this room is away from everybody. We can close it when people don't need it. We thought, perfect. This is the perfect space for a studio. What we didn't know is that there's absolutely no insulation from here to the outside. So when it's cold outside, it's cold here. But it's hot in here. And then when the people are here to mow, you get
quite loud.
You get to hear everything. But welcome to the Medicare Cafe. If you have any questions, comments, concerns, threats, or promises as we're going through the day, guess what? You can air your grievances or ask your questions. This is my phone number.
A lot of them today.
Honestly, I'm curious because again, like I'm talking about, like this is obviously what to do on paper. Can't wait to hear like you're like okay, but in practice, right? The agent perspective of this.
Yep.
This is my cell phone number. Text me at any point, either during the show or outside of the show. I'm happy to answer that for you. Or you can just like that's not really her number. Yes, it is. Text me. I dare you. Or of course, join us on live chat. Ask us your questions live as well.
So what are we talking about today?
So today we're talking about revenue recovery. And this is
because
something...
we're losing some.
We're losing potentially a lot of revenue for agents and uplines as well. What's going on? Yeah. Lots of renewals. So what's going on with like this? WellCare, as we know, this is not news. And if it is news to you, you have so much research to do before in the next week and a half. But WellCare came out and basically said that we're not going to pay commissions on 2025 business. And guess what? Anything left on the books, we're not going to pay renewals on that. So no commission. That's just on PDP, their Medicare Advantage plan, which I think they said over like 80% of agents who sell WellCare business does not sell their PDP, only sells their Medicare Advantage plan.
Oh, really?
I know. Missouri, we're a lot of states.
Interesting.
Exactly. Well, because reminder that WellCare is, again, a Centene product. They focus primarily on the dual special needs market. And going into 2025, they are going to have a lot of the states... what's it called? And not interactive. In whenever the Medicare and Medicaid, they have both the Medicare and Medicaid, so they'll be able to use the SEP. What is that called again? A dual. Like with the new SEP, how if you have the only way you can use the dual SEP in 2025 is an integrated. So they will have a lot of the integrated plans and states that the integrated plans are an option. So don't want to talk crap on WellCare because if you are in an area, it is possibly right, the MAPD, those are going to be commissionables. We're talking strictly about the Part Ds.
You know what sucks?
Tell me.
Well, lots about this today does.
Okay.
But over the last week, I have written 6 WellCare PDPs. And every time I was like, why am I doing this? Why am I doing this?
Why are you doing it?
But when the next closest was $100, or they take no medications, I was like, okay. And I just told them, I was like, we're going to sign up for this now, but just know, you're going to hear from me in a month and we might be switching. But then I was like, I'm just creating more work for myself.
And like you're chasing,
but I didn't know.
Amount. So
I wasn't ready to like handle it. I wasn't ready to handle it.
Yeah. Well, so it's hard. So
proceeded on.
So like what we were talking about was going on with WellCare. So there's all that. Within WellCare, we were all like, okay, so come. There's no way WellCare, come at October 1st, they're going to have crazy premiums. They're going to have crazy all this stuff. It didn't happen, guys. WellCare in 2025 is looking like they're still going to be low, sometimes even still $0 premiums, very, very low premiums. They're not even going the minimum $35 for the demonstration. So
the what?
The demonstration, the Part D premium demonstration. Right. Well, we don't have time. We'll talk.
Sorry.
No, you're okay. But whenever most companies are going to have at least a $35 premium increase on their Part D plans, WellCare's not. They're sticking to $0 in a lot of areas, or very, very low premium, making them the option for those individuals who are on a $0 or those individuals who are not on medications, right?
Yeah.
So the thought behind that is what's going on is that we really thought it's heartbreaking, but it's also actually kind of a positive thing, because those tons of people who are on WellCare, you're not going to have to spend time chasing PDP business, which frankly is not a profitable thing to do. And so it's trying to kind of understand and calculate for yourself, what is the threshold of revenue you're willing to lose?
So this is another aspect of it that I don't know if it would affect everybody, but I'm curious what your thought is. Mm-hmm. So like right now, SBS, like our customer support team, can help all of our clients with claims and questions if we're getting paid on them. Mm-hmm. So like if we are no longer getting paid on WellCare, even if our clients don't make a change, can we still call on
them? Yeah, WellCare has said that you will still be agent of record and still be able to service those people if they stay on the plan, even though you're not getting compensated for it.
Okay.
But the question comes down to, is it worth it? Again, talking about
right.
And let's look at that. So again, a couple things going on. Is it worth it to rewrite those plans? What about non-commissionable options? Because like you said, some cases it is going to be the lowest cost plan for them. Mm-hmm. Now, I'm never an advocate for writing a non-commissionable plan, because a non-commissionable plan tells me that, hey, the company doesn't want the business, and they don't value my services as your agent. So if you'd like, so I'm talking about like with new business, right? New business, probably starting now.
Yeah.
But just saying,
I know,
if you want me to be able to help you and service you, this company has made it very clear they do not value insurance agents. So I don't want to put business on them. They've made it very clear they don't want the business. Mm-hmm. They're not making it easy to write, and they're not incentivizing me to help you with this. However, and that's kind of like moving forward, the conversation can have to be like, yes, this plan may cost a few, $100 extra a year, what the case may be. That might be worth it to say, if you want my help, my service, then let's go with the plan that's going to cost you a little bit more. Now, the other side of that is like two things. Number one, if it is going to save them hundreds of dollars a year.
Yeah.
Right?
For sure.
That's not the same conversation. Yeah. I don't know, in good conscience, you want to do something and save them that couple $100 and write a new plan or do something. You're going to put them on that non-commissionable plan.
It's going to be completely case by case.
It's completely case by case, for sure. And I'm talking about like new business. New business, if you're sitting down between now...
old business, I feel
Well, let's get to the old business. Okay. So if you're sitting down with somebody between now and the end of the year, it is case by case new business. You have that conversation. Is it worth it to you to spend a couple extra dollars and have me be your agent, or am I going to write you on this non-commissionable plan because it is truly going to save you a ton of money? That's the question you ask between now and the end of the year.
Right.
When it comes to what's going to happen in 2025, this AEP, we're talking about existing business, people who are on the books. Mm-hmm. Are you willing to let hundreds of dollars a month, in some cases, and in most cases, thousands of dollars a month, fall off the books because you're keeping them on WellCare? My 2 cents on that. If you will if you are going to, let's get into what your 3 options are. Let's start with that bottom option. Chasing that PDP business, taking everybody on a WellCare plan and moving them off that WellCare plan because you're mad at WellCare, you don't want to give them the business, or you're losing thousands of dollars of revenue in those renewals, which is truly a thing. Will you make more money and help more people by chasing $25, $50 commissions?
Right.
Or will you make that money by adding more lives to your book of business or adding product lines to your book of business? Mm-hmm. What's going to make you more money? What's going to help more people?
Adding new lives.
100%.
For sure.
So that's the point I want to make is, yes, WellCare, guys, if you have a book of business, and the majority of your WellCare PDP are people who are not taking medications and trying to avoid that Part D penalty, one, it looks like that's going to continue to be the option, and it doesn't look like you're going to have to move that book of business. Again, which I view as a really, really positive thing, because you can use that time
for sure
to help more people and to help people with bigger benefit packages. So your thoughts on that?
I agree completely. I'm still just thinking like, I still, with my current book of business, I'm going to just have to categorize them and like, okay, WellCare is the best for them. Is it the best by like $10 or $100? I don't know. Like if it's a small amount, I could see myself still offering.
Of course. Well, and I'm not suggesting that we don't do prescription drug plan reviews with our clients. That's not what I'm suggesting.
Right.
But I've talked to a ton of agents who understandably are upset, saying how much money they're going to lose whenever WellCare becomes non-renewable, non-commissionable, how much money they're going to lose. And they're saying like, so I got to go and rewrite all my WellCare clients. That's not the case.
Right.
Because you're going to spend more time doing that versus doing other profitable, more revenue building activities.
I just don't even know what to expect. Like, so do we know for sure WellCare is going to be the lowest?
Yeah, they can't. I can't speak to across the nation, but they came out with what their premiums were going to be, and they're still going to be in the areas that we look the lowest premium by far.
Okay.
Now, we don't know formularies. We don't know things like that.
Right.
It could be the case that their formularies, their tiers look about the same. Like their co-pays on their tiers are really similar to what they are this year. But like their formularies are the only thing we haven't seen. So, but for your individuals who are on a PDP for strictly to avoid that penalty, WellCare looks like it's going to be a good option.
That's the one I'm thinking of, because I have tons of clients who really don't take any medications. Like I am not going to waste my time moving them.
No, 100%.
Because especially if they're the lowest.
Exactly. So ways to we're talking about recover that income. We talked about this, number one, adding more product. Obviously, we talked about hospital indemnity. GTL just actually had some really significant upgrades to their hospital indemnity plan.
Oh.
They had a few of them, but the one that they're most excited about is a rider that allows you to increase your benefit amount without going through underwriting.
Oh, that's nice.
Yeah, so like if you're on a plan this year and your copay is $250 day 1 through 6, and then next year that same plan goes up that you now have a $350 copay days 1 through 10, you can go back to GTL, increase your benefits, even if you've had health conditions since then.
Because they know the copays are going up.
Right? That was 100%. They saw what's going on with the Medicare Advantage plans. United Healthcare was in our office here last week, and they were talking about how CMS gave each carrier 3 years to kind of pull back on benefits. And I didn't know this, but this is what they mentioned yesterday. That's why, our UHC pulled back year 1, other carriers didn't. So whenever UHC is pulling back not nearly as much this year, other carriers are having to compensate for 2 years. So anyways, all that to be said, GTL is seeing the writing on the wall and saying, hey, if you want to make sure that you can cover that moving forward, here's this rider that allows you to add more without
I think that's genius, because I feel like of all the sneak peeks that I've looked at, one of the biggest thing that has jumped out to me is that increase in inpatient hospital copay.
Yeah.
So I can comfortably say I will sell more GTL this AEP.
Oh, that's awesome. Yeah. And again, it's talking about what does that do to your bottom line. You might
really slow over there.
Oh, this one, we always have a 30-second delay.
Well, but my face was like,
oh, I bet it was a really pretty face, though. We always have a 30-second delay in case, like, Carrie hulks out and throws things in here.
Yes,
that way we can stop
Flip
the stream.
table.
Exactly. We can stop the stream before you guys see any of the real chaos. And, yeah, in case we see Carrie hulk out. But, no, that's 100%. And then, of course, like, we've been talking about it a ton, is setting yourself up right currently to set yourself up for an annuity conversation.
Okay.
Annuities, something that we've just have been, our mind blows. We work with Retirement Realize on our annuity production, and their research shows that if you have 40 Medicare clients, you're sitting on about $35,000 of commission.
Yeah, that's crazy.
Which is nuts. And that's not to say like you're going to sell 40 annuities. It's going to say on average, 40 annuities ends up being about 10 clients who actually qualify or be a good candidate. Out of those 10 clients, you'll sell 4 or 5 of them. On average, about $500,000 in premium, which would equal about $35K in commission. So really fast way to kind of pick up those pieces.
Yep.
If you're going to lose, 10 to 12K in renewals of WellCare PDP, write a couple annuities, you made that up and then some, and you're not chasing that PDP business.
Well, and I'm sorry, my wheels are still turning on the GTL.
You're good.
Just because I don't write a ton of HIPs, and a reason is that just because I don't write a ton of MA plans, but I can see people worrying about that hospital increase.
Mm-hmm.
So, but like the amount of increase isn't comparable to like the premium of a GTL is so much lower.
Mm-hmm. Right.
So I just think that's going to be
I think step one, write the dang hospital indemnity plan.
Right.
Let's talk about how do we add to their benefits in step one. But like, I see the numbers. I think GTL did their research, and it was less than 1% of people on a Medicare Advantage plan have a hospital indemnity plan.
What? Less than 1%?
I will double check. I will fact check
surprises
myself. I'm not
me.
going to talk about animals being eaten in Springfield. I will fact check myself. But I do know that it was a completely like an outrageous, it's abysmal how many people on a Medicare Advantage plan actually just have a hospital indemnity.
That's crazy.
So again, if you're meeting with those people, it is you're going to make way more money and help way more people. Don't chase the PDP. Help with the PDP. I'm not saying like still do your PDP reviews.
Yeah.
Use technology. Again, Medicare Center is going to be using AI technology to tell you which of your clients you should absolutely meet with, like based on the formulary of the plan they're currently on, based on the medications they have entered in Medicare Center. Like, hey, this person's they really need a new PDP. Right. Use the technology to tell you who is it that you need to be seeing, but more importantly, help with the PDP stuff. Don't chase it. Don't do it spitefully. Don't let your emotions about how pissed you are cloud what's going to be financially best for you and what's going to be better for your client.
Well, and like the other thing to consider is WellCare's not the only non-commissionable PDP.
No, they're not.
So like I vividly remember, what are there? Right now I think there's three that aren't in Missouri. And I remember running a drug list for somebody, and the first 3 in a row were all the non-commissionable ones.
Oh, yeah.
And I'm like, so if that happens again, if the first 3 or first 5 and they're paying, we got to go a lot higher for it to get a commissionable. Like I'm not gonna do that.
I think it's just all about like again being able to speak confidently to your clients. And like I'm fine with saying, hey, this plan is gonna cost you X amount of dollars less a year than this plan. And this again talking about if somebody, you're talking to a new person or talking to somebody who does want to review their drug plan, but just simply saying, I can't, if it's not commissionable, I can't help you.
Yeah.
And that's just like, again, like if it's not commissionable, you are going to end up enrolling them in stuff, but you can't it's not financially intelligent to spend a bunch of time servicing non-commissionable stuff.
Yeah.
So just being outright, this company has made it very clear they don't want the business.
And they know you're worth it or they wouldn't be talking to you. They wouldn't.
Snap.
Wouldn't be there.
My queen. I do have a question on here I wanted to address. So if somebody's on a WellCare Value Script 0 premium, there's no renewal. Do we have to re-enroll them for the $0 plan? They take no med. So when I say, I kind of made a little verbal flub a second ago. The plan is renewing. That plan will be available in 2025.
You're
so if somebody's currently
renewals.
Exactly. If somebody is on that plan, they don't have and they want to stay on that plan, they don't have to do anything. Just know that you will no longer be receiving any compensation for people on that plans. That's on the other side of that, Aetna, they're doing a non-commissionable plan. So their PDP will not be commissionable in 2025. However, anybody who is on that plan in 2025 that you wrote prior to January 1st, you will be receiving a commission on. You will be receiving those renewals. So anybody who's already on that plan, you'll continue to get paid on them. You just won't get paid for new business moving forward. So WellCare is done.
Yeah.
Aetna will be paying on existing business, not new business.
WellCare's just really wanting us to hate them right now.
Hi, it is an interesting, I just don't understand. I do understand.
Do you think their reason for that is to push people on Advantage plans?
100%. The 100%.
But like, how can that be allowed? Like, I don't know why, I don't know.
They're the plan. They're the plan. It is allowed because they're not proactively calling these people. They're calling their current members and saying, would let me see your information. Would it make more sense for you to be? I mean, that's what it is. If you
Yeah.
put your people on a Medicare, on a prescription drug plan, they are now a lead for them to become the Medicare Advantage. And again, understanding that like other like UHC, for example, they're always really good about protecting agent of record. So if they do talk to somebody on a mapping or on a PDP that they switch to another Medicare Advantage plan, if it's an internal sale, they will protect agent of record. Now, if it's another agent that takes your business and puts it from an MAPD or PDP to an MAPD, it's another agent, a field agent, is not protected. Only if it's an internal sale is the AOR protected. So good to know. But again, just understanding, guys, I know that it can be really, really, and then again, kind of looking back at this, one thing that we looked at going into this AEP was that there are pockets of stability. There are pockets where people are like, I don't know what everybody's upset about. My plans, I've seen the plans. They look great. They look perfect. I don't know what people were talking about with all this disruption. And that's certainly, there are pockets of that. So if you are somebody who is in an area where you don't see a ton of disruption, your clients' plans and this year look like they're viable options for next year, reach out to us at Senior Marketing Specialist because we can help point you to where, hey, if you're willing to look 30 miles north, south, east, or west, if you're willing to do, some phone sales, we can plug you in to where there is massive disruption, huge service area reductions, things like that. So just making sure, like, if you are losing those revenue, adding lives to your book of business will more than make up for your loss of PDP revenue.
Yeah, I don't think we need to read that one.
Okay. All right.
I don't know how we delete things.
We'll have to figure that out. Okay. Guys, that being said, I love what we do.
Made me lose my train of thought. I'm not sure I heard the last 30 seconds of what you said because I was reading that.
I'm going to send a text. Any questions, comments, concerns, threats, or promises, please let us know. But do you have any final thoughts on that?
I don't. I think, like, yes, this well care seems like a big issue. It is to me, especially since I write so much
I don't
want
to discount that for sure.
But I'm also trying to come at it with the perspective of this isn't going to be a normal AEP. There's going to be so many more shoppers, 75%? And so there's just going to be more opportunities to add those lives that I think well care will be just forgotten. Like that, it's not going to be that.
It's just don't get caught up in the crap. And it is crap, but I don't want to discount that at all. Don't get caught up in like the I'm mad.
Sucks, but
so like I'll show them. I'll just move my entire book of business.
Yeah.
Drop in the bucket.
At the end of the day, I'm really not doing a ton different because of that.
Yeah.
I guess.
Fair enough. Awesome. All right, guys. We do have, again, just a couple weeks left before AEP, before October 1st. If you are somebody who you're really looking to really turn it up this year, find an area disruption, add lives. If you are hungry this year, please give our team a call. We are wanting to make sure that we can help our agents who are hungry thrive this AEP, help you find ways to do so through events and other avenues of getting more lives on your books. So I'm just so thrown off.
I know.
What's so wild.
So wild.
Awesome. All right, guys. So you got to get out of here. So until next time, you all have fun.
Make money.
And give